Hi, I am Dr. Ramya Ramalingam from Jeevanmithra Fertility Center, Cehnnai. So now I am going to discuss about the male factor infertility. So we all know that both husband and wife can be equally responsible for the infertility problem. So first visit should be with both husband and wife to the gynecologist. So in the first visit, semen analysis is the most important test. Semen analysis, if properly done, is a very valuable investigation. So it has to be done properly with 3 to 5 days of abstinence. It has to be the semen has to be collected in a non-toxic sterile container, which has to be obtained from the lab or the fertility center, and any container from the house should not be used for this purpose. And the complete collection is needed to get the accurate report. Second, suppose if the first semen test is abnormal, you need not get panicked. You can wait for 6 weeks and then you should have a repeat semen analysis. And even if the second repeat analysis is abnormal, then it is better you consult a fertility specialist, and complete hormone testing and physical examination of the male is mandatory at that point of time. So regarding the causes of male factor problems, most of the time when during the complete evaluation, we can find out some small issues which can be corrected. Regarding the reasons for male factor problems, smoking, drinking, prolonged drug use, cancer chemotherapy in the childhood, infections of the genital tract, stress, overweight, hormone issues, all these can be reasons. Apart from this, in majority of cases, we couldn't find any reasons for the problem. We label them as idiopathic factor. In idiopathic factor, the main treatment will be to give antioxidants and change the lifestyle, include lot of fruits and vegetables which contain antioxidants in the diet, reduce weight when there is overweight. After all this antioxidants therapy, if there is improvement, then it is good. If there is no improvement, then for mild male factor problem, it is better to go for intrauterine insemination technique. Intrauterine insemination is a simple technique in which we collect the semen from the husband, wash the semen sample, isolate the motile fraction in the semen and inject it directly into the uterus of the wife whenever there is ovulation. So this increases the success rate to a certain level. So this can be used only in cases of mild male factor and cannot be used for severe male factor. In severe male factor patients, that is when the count is too low, less than 5 million, when the motility is too low and the morphology is too less, it is better you go for the advanced treatment which is called as IVF ICSI treatment. ICSI treatment is really a boon to severe male factor patients, in which we take out the husband's semen analysis we try to take out the best sperms and inject directly into the egg of the uterus, so that the fertilization will happen effectively, and the fertilized embryo we select the best one and transfer it directly into the uterus. With this technique, even severe male factor patients, the chances of having their own genetic offspring is very good. And in extreme cases of azoospermia, in which the semen analysis shows absolutely zero sperm count, also we can do a procedure called TISA, testicular sperm extraction aspiration, in which we put a needle inside the testis and find out whether the sperm production is happening or not. If sperm production is happening, then we call it as non-obstructive azoospermia. In extreme cases of male factor problems, that is even in azoospermia is a condition where there is no semen in the semen analysis, where there is no sperm in the semen analysis. Even when there is no single sperm, we can completely evaluate the male patient to find out the hormone condition and then put a small needle inside the testis under anesthesia and try to find out whether there is sperm production or not. And accordingly, we can classify them into obstructive or non-obstructive azoospermia. In all cases of obstructive azoospermia and in 80% of cases of non-obstructive azoospermia also, there are chances we can take out the sperms from the testis, and that can be effectively used for ICSI treatment with their wife's egg, and effectively we can produce a baby and the success rate is very good. With this treatment, even azoospermic males, there are chances of having their own genetic offspring. Thank you.